We have some new committee members who might not know.
I've known Sarah since I was in college. I came to living the basic needs budget as the student body president. So,
We have a little history.
yeah.
Okay.
I know you.
Yes, yes, so you too. So Sarah Teachout, I've been the Director of Government and Media Relations for Blue Cross and Blue Shield of Vermont for 5 years already. Time flies, right? So
He was previously with the Joint Fiscal Office and had a regular seat in this room.
Any relation to the notorious and famous and well respected Peter Teachout?
second cousins.
There were a lot of teachers.
So I just wanted to give just a very brief overview on the Blue Cross and Blue Shield of Vermont. Some of it I didn't know when I took the job, so there you go. We're a licensee of the Blue Cross and Blue Shield Association, and it works like a franchise. There's 34 blue plans across the country. There's, I think, 6 of them that are large multi-state plans. And the one most people think of is Anthem, which has a new name now. It's called Elevance.
Oh, I just saw Anthem in Maine with this.
Yes.
sign.
Yes, they are the blue plan for Maine.
We were Vermont, New Hampshire.
Way back, yeah. So Anthem is the only for-profit publicly traded blue plan. The rest of them are all not-for-profits. And there's 12 regional blue plans, which is what Blue Cross and Blue Shield Vermont is. We're only the state of Vermont. There's about 8 that are state-specific plans, and then a couple that are actually regions, like Capital Blue Cross and so, and we are the second smallest blue plan in the country.
Was it smaller?
I think it's Wyoming.
I was gonna say,
It's always Wyoming. Yeah. So, and there are, just so you know, there is Blue Cross and Blue Shield internationally. There's a plan in Canada. There's a plan in Costa Rica. Unfortunately, I never get to visit. So, and then I think the only other thing I really wanted to say is that we, unlike a lot of insurers, we offer insurance in every single part of the health insurance marketplace. So we offer qualified health plans on the exchange. We offer large group fully insured. We do self-funded ASO. We do Medicare supplement. We do Medicare Part D, and now we do Medicare Advantage. So we're the only carrier that really covers the entire spectrum of insurance. Most of them sort of focus on different market segments.
And you are by far the largest.
So yeah, we're about a third of the population here in Vermont. So about 1 in 3 Vermonters has Blue Cross insurance of some form. It could be a retiree plan or one of the other ones. So
Yes. Oh, yes.
yes, and because we do the teachers and the state of Vermont, retirees plus active, we do have a pretty big, broad swath of the spectrum. So you asked me to talk about affordability and health insurance premiums. So I was going to focus on that. And I was going to start just high level of what's in health insurance premiums. And I did have one sort of visual that I could talk to briefly. And then I was going to talk about, I think there's 5 sort of priority issues that Blue Cross and Blue Shield of Vermont has here in the State House this year that I wanted to just mention so everyone knows what they are. So when we're talking about health insurance premiums, for Blue Cross and Blue Shield of Vermont, 92% of every dollar you pay in premiums goes for medical or pharmacy services. So, and then the other 8% goes to pay for the cost of providing health insurance, which is the cost up at Blue Cross and Blue Shield. So the IT, the doctors and nurses we have on staff doing utilization programs, as well as taxes and fees. So we pay, the provider tax, or not the provider tax, the claims tax that goes to fund the IT systems here, the healthcare IT systems. We pay for the Green Care Board portion that regulates us. We pay for some of the budget of the Department of Financial Regulation. So those are all built into that piece.
You regulated.
Yes, and that's common.
Yes.
More lobby.
Yes, thank you. I'm part of that
Thank
budget.
goodness.
Good afternoon. What, can you say something just about Blue Cross Blue Shield's overhead rate compared to others? I don't know. 91, 92% sounds like relatively low overhead. I don't know if that's, if you know about the industry, you can sort of place yourself in it, or?
So I know compared to other Blue plans, I don't know as much about, widely about all insurers. I do know that the federal government mandated that in premiums sold on the exchanges nationally, 80% of every dollar has to go to medical care. So we think that's actually pretty low. And yeah, you want a plan that spends less on administration and more on the cost of care. Among Blue plans, I think we're in the one of the lower, like maybe the lowest cost third. And I would say that Blue Cross and Blue Shield of Vermont struggles with what we all struggle with here in Vermont is economies of scale. We just, the IT system costs the same essentially to run a claim system for 200, 300,000 people as it does for 8 million people. So that's where we always struggle. And you've seen it with Vermont on everything we try and pay for here.
That's surprising, I would think.
Everything in healthcare seems to be scale. Another area that we always struggle with is buying the pharmacy services and negotiating with the manufacturers. That's why we align ourselves with a big national pharmacy benefit manager, because they use the scale and the volume of what they're purchasing to negotiate lower prices. And just doing that for our plan alone is not enough.
I had another question, but maybe it doesn't fit in right now, but I was reading how Blue Cross Blue Shield stepped out of One Care.
Yep.
And I don't know if that's part of your presentation.
It is. I have it right on the list.
I asked, I said, I'm sure it's gonna come up.
Yeah, I will. If you don't mind, I'll go in order of what I have, but I'm definitely going to touch on that topic. So other than the healthcare services and the administrative costs of insurance, the cost and utilization of services grow, every single year. The two things that grow the fastest in health insurance are pharmaceutical costs. They grow at double-digit rates every year. And recently, hospital costs have grown at some pretty large rates. So here in Vermont, the age and health of the population being covered is another big factor. Age, I'll say, is a good proxy for health, not always, but that's, we don't age rate, but looking at the age across the population and the health is a big part of it. And then the design of the plans and the services being covered. When you're specifically talking about premiums, that's a big part. How much is covered through premiums, how much is covered through out-of-pocket costs. I'm sure you hear that from your constituents. And the last thing I wanted to mention, so I did have, can you pull up the dollar for me? It's my only visual, I promise. Maybe, and I can keep talking. So interestingly today, the Blue Cross and Blue Shield Association launched what they're calling a healthcare affordability solutions proposal at the federal level. It's on your iPads too, whenever you have a chance. So this, just to give you the scale. So retail prescription drugs are drugs that you buy in the grocery store, and I know these are colors. So that's 14.1%. I apologize. And then another channel where people receive a lot of prescription drugs is through the medical benefit. So if you go to the hospital and either inpatient or outpatient, a lot of that's infusion drugs, chemotherapy drugs, very, very expensive drugs. Those are in your medical benefit, but that's another 6.1%. So if you add those together, you can see that pharmacy, both in and outside of the hospitals, is growing quickly. Then inpatient hospital stays, 18.7%. And then all other medical services is that big sort of gray bar, 52.3%. And then this is old data, but I talked to our actuary. She didn't have time to update it for me, but she said it doesn't change very much. So administration and care management, those are the programs happening within Blue Cross, 6.9%. Taxes and fees were 1.2%, and member reserves, that's the one I should have mentioned before. So we hold reserves in case of.
I believe we do require you to,
Yes.
don't we?
Yes. The
In
Department of
case something like COVID shows up and your costs suddenly go up.
Yes, so the Department of Financial Regulation has a bulletin mandating how much, a range for us to keep our reserves. And we are at the very bottom of the range, so we keep the lowest mandated amount. That's all I wanted to do with that, so thank you. So I mentioned, oh yeah.
Well, you're mentioning reserves, so, and then the chair said, in case something like COVID comes up. So what did happen to Blue Cross Blue Shield with COVID coming through?
Yeah, so Vermont was lucky and we didn't have we didn't see what New York City or other areas of the country saw with COVID. So for the 1 year in 2020, we saw an increase in our reserves. I think it was about 20 million, but I have the numbers. And then the following year, when everyone went back to the doctor and they were sicker and had worse care, then we saw the opposite direction. So we swung in both directions with our reserves. They went way up for 1 year and then they went way down for next year.
Did it net out okay, or did it come
So
through with
we're
rate pressure?
still kind of at the low end of the scale. The philosophy of Blue Cross is that we don't want to charge members in their premiums a huge amount to try and refill reserves in 1 year and then have to give back money the next year. What we like to do is have sort of an even charge. So in our rate filings, we always request 1.5% of premiums go into reserves. Generally, the Green Medicare Board cuts it a little bit, and it's less. And in dollar figures, it's about $134, $135 million in reserves that we have. That as a percentage of the premiums we pay about 1.6 billion in premiums. So it's a pretty modest amount of reserves. It's 1 to 2 months worth of claims. So if we didn't have money coming in for 1 or 2 months, there would be no money. So I did mention this national Blue Cross Blue Shield Association Healthcare Affordability Solutions announcement they launched today down in Washington, D.C. Just lucky timing on our behalf. I think the point I want to make here is that a lot of the things impacting costs and prices and affordability, unfortunately, are not something that the Vermont legislature or the state of Vermont can do a lot about. I mean, there are things that we can do, but there's a lot that's really driven nationally. So I think it's important that we advocate at the national level, and I'm quite happy that the Blues Association is doing that. This is actually one of the few projects that I've been involved in representing Blue Cross and Blue Shield of Vermont. So I helped develop the proposals. I'm not there at the launch, obviously, but I think there are things that are important to Vermonters and our plan as well. There's a big component of it that is lowering prescription drug costs. And there's a whole list of bills in the handout that I gave you that are before Congress that we would advocate for those. And some of the things that they are a ban on pay to delay arrangements for the entrance of generics. So that's something that's happening with drug companies. They are paying other companies not to bring their drugs to market so that there's not competition.
That's a good one. This committee spent several years trying to get a handle on drug costs. We ended up getting sued and losing at one point. It started out as a New England legislators committee or group. My predecessor in this seat left to become the director of that group. It grew to be a national legislators group, about the same time as NCSL. And then it all fizzled. Individually, even working as a group, we couldn't get a handle on it. We went so far as to say you couldn't go to a conference and accept anything from a pharmaceutical company, which led to people going to medical conferences, and there was free coffee, and it would say, except for Vermont, signs. We modified that a few years ago, but we really did try.
Yeah, so, yeah, I know you worked hard on it. We do believe a lot of this needs to come at the national level to really have an influence.
Yeah.
Just to put it in your mind, there was a congressional research report that came out last summer on some of the abuses of the FDA system for drug approvals and the things that are going on. So there are things like this pay for delay arrangement. There's sort of abusive citizen there are like interventions in the process to approve new drugs that it's truly not citizens bringing these up. It's people doing it on behalf of drug companies. So it's quite an interesting congressional report, and they sort of laid out all the abuses in certain areas. And we, Blue Cross and Blue Shield of Vermont specifically sued on behalf of Vermonters on one particular drug that was identified in that report that we believe we've been overcharged for on behalf of Vermont. So it's an interesting area.
So it would seem, on one level, probably a little simple, but that generics, many things will go off patent or whatever, and then they become a generic. So you might expect prices to go down because you could start generics, but it doesn't seem like that happens. And why? I don't know if the percentage of drugs prescribed that are generics has changed one way or the other, and why we're not able to get. Because whenever I get something that's generic, it's stunning the difference in full retail on the name brand version. I mean, well, literally like $1,000 for the name brand version and $8.58 for the generic or something.
Yeah, no, you're absolutely right.
I just did a prescription for my husband. It used to be $300 for 3 months. It now is $250 for 1 month. And we managed to order it online from Canada for $36, including shipping, for 3 months supply. And that is the difference. The Canadian government buys and they negotiate the price.
So I know a little bit, but I'm no expert on pharmacies. Nancy Hogue is our new head of pharmaceutical management because Brian Murphy left Blue Cross. So it was a loss, but Nancy's a gain, as you know. She used to run the Medicaid
I was
program.
gonna say, I know Nancy's from
That's how you know
Health
Nancy.
and Welfare.
Yeah, so if you ever want to hear from Nancy, she knows lots and lots of details. So there's a lot of stuff happening on generics. There's been a lot of ways that brands have been trying to delay the entrance of generics into the marketplace.
Like timed release versions of things, or
Yes, they changed yes, exactly.
My favorite, the purple pill and the new improved purple pill. And the doctor from the Plainfield Health Clinic, Dr. Matthews, who has since retired, came in and did a really good one on, they do exactly that. They added time release, and it costs 10 times what the old pill does. You could take 2 of the old pill and still be at half the cost of the new and approved pill, which had a time release in it.
That's what's happening. And then the other thing that's happening is a lot of the manufacturers of generics, the margins aren't so good, so they close. If there's too many of them making the same generic, and then there's no competition in the generic marketplace. And then remember that guy, Skritzel, he bought.
Oh, yeah.
Yes.
You know who I'm talking about?
Okay.
Yeah, so then he bought a company that made one generic drug, but they were the only manufacturer of that drug in the world, and they raised the price, 1 million times. So that's the other thing that's happening in the generic space.
And
So
then there's biosimilars, which we won't get into.
EpiPens.
EpiPens, insulin.
So one of the things that Blue Cross Blue Shield of Vermont is doing in association with many others. It's not just us. We've invested in a company called Civica RX. We're building manufacturing facilities in the United States, and we're manufacturing generic drugs. So we are manufacturing insulin, and we're manufacturing, I think 4 or 5 other generics.
But I remember.
Yeah, the insulin should be coming, the factory, like the shell of the factory is built and they're working on the insides, and we're expecting in a year that we'll have insulin in the marketplace. The stated goal is to sell it for $30 a vial. My understanding is it costs about $280 a vial on the open marketplace.
How long does it last?
I think it depends on
patient.
yeah, on the patient. I think some can make it last, a couple weeks, and some need a lot more. So, and that's only one way it sells, and then they have it in other packages too, groups of it. So, but that is one thing that I think is really pretty cool, that we've done to try and lower the price of drugs, but it's not an immediate, we've been waiting.
It's not gonna get you $30,000 a pill Alzheimer's treatment and other things that are showing up.
Right, we can't solve those
And
problems.
is that only for Blue Cross customers or just?
No, it will be widely distributed, and a lot of companies invested. It's been a big effort with some nonprofit foundations, that some PBMs invested. I think the state of California invested. So the idea is to distribute it widely. And in addition to solving the price problem, I think it's a way to try to disrupt the drug supply chain. Supply chain.
Yeah, absolutely.
So those are the things I wanted to mention. There's a bunch of other stuff in the report. They want to strengthen antitrust laws through the Trade Commission to prevent market consolidation. I don't know, that's not easy to do. And they want, one of the things they've asked for is to permit coverage before the deductible of telehealth services and health savings accounts. So people with high deductible plans, the IRS is preventing us from using telehealth prior to the deductible. So that's another thing we're advocating for on the federal level. I thought I'd just give you a flavor of a few of the things in the very long document. So I'll move a little faster so Mike has the time.
Well, we just told the commissioner that we're running 15
Okay.
minutes late because we ran late with you.
I'm sorry, I can go a little
He's just
faster.
doing an
Oh, that's all right.
introduction to the tax department, so.
Well, you need that too. This is the right committee for that. So I just wanted to talk about state policies and things going on in the legislature, or issues that I want to touch base with you on. The marketplace structure study and keeping the marketplaces unmerged for 3 more years is our top priority issue for affordability for small employers.
And that bill, because I'm sponsoring it, will be coming.
I've been waiting.
It's coming. I don't know why it takes 4 weeks to get it out.
Yeah. So then the second thing I wanted to talk about was One Care Vermont. So Blue Cross is not going to contract with One Care Vermont in 2023. As we stated when the decision was made, we're unable to have an agreement this year because of the lack of tangible quality outcomes, the inability of One Care Vermont to bend the cost curve. That's something we really need for our members. And then we had a number of concerns about data security and privacy that we've tried to work through with them. Those aren't quick and easy issues. And so I think our intention is to keep talking to One Care and keep working through the issues, and hopefully we'll be able to do something in 2024 if we can make it beneficial for our members. So when we made the announcement, we knew that primary care practices are fragile, and we would be, hearing concerns about the payments we make. Right now, they pass through One Care Vermont, but we make care coordination payments to One Care Vermont that then go out to primary care practices. So we committed to continuing those payments. What we committed to was the first 6 months of this year with the opportunity to kind of look and see what makes sense going forward. It's not the intention of Blue Cross to pull the rug out from under primary care practices. There have been letters, I don't know if you all got one, from the Vermont Medical Society about some wraparound payments that One Care makes. It's not money that comes from Blue Cross, so it's nothing we control. we're going to continue paying the money that we've paid. So it's money that comes from the hospitals as part of their affiliation dues, and some other sources I'm not super aware of. If OneCare wants to, they can continue to make those payments as well. It's well within their discretion to continue those payments. What we don't want is an unfavorable arrangement for our members to continue just because of, you know, these other arrangements that are happening around our contract. So I'm happy to try and answer questions if you have more specific questions about the OneCare
This
contract.
one would probably go through health and welfare.
If there's anything to pass, yes.
Involves money, it might make a stop here, but it would have to get, and I am assuming they're going to be looking to OneCare. We have every year since I was on there.
Yeah, and OneCare is required now to resubmit their budget to the Green Mountain Care Board. I think they're having a hearing on the 30th. Where they're supposed to revise it to reflect the fact that Blue Cross is no longer participating.
That's gonna be a pretty good chunk.
So, you know, the Green Mountain Care Board can also look at those pass-through payments and decide whether or not OneCare still needs to make them on behalf of the primary care practices. So there is some oversight that should happen over there. So I don't know what will come to the legislature or not.
So was it, and I'm not sure if I remember it right, but the leaving OneCare means 90,000, approximately 90,000 Blue Cross Blue Shield.
So that's
Step out, is that right?
That's the total amount of lives. Those aren't the ones that are attributed. The ones that are attributed are fewer, and that's because your primary care practice has to be participating in the OneCare network. But that is the total number of lives that we have. Yes.
And it's not your job, but I bet you know. OneCare, how many years are we now? 6 years?
I think it's 7. It's 7. There were a couple, you know, preparatory years where we were working on things without getting into risk sharing. And Blue Cross has participated in every year since the beginning. So this is a big change.
I looked at other chairs. Chair's meeting is at 4:30.
4:30.
Yes, okay, good, then we've got time. I thought it was at 4:30 last week, since we all said we can't make it, and it was at 4 o'clock, so.
So I had 3 more things I was just going to mention briefly when we're done.
Briefly before we leave.
Yeah, sure.
Okay, this may not be your, I presume you were dealing with Blue Cross relationship with OneCare, but having served on welfare with the chair. What did the people of Vermont, what have we got for our money?
That's been an ongoing question.
Really?
Yeah, I
Just a
mean-
basic question.
I think that the Blue Cross, along with everyone else, felt like we should give it some time, that we're not going to see change right away, but we are 7 years out. We should start to be seeing some results. And I think that's one of the unfortunate things about the whole OneCare concept is it was designed, I think, to mostly be invisible to patients, but we want to see the results of our work. I mean, I think patients want to know this person who's helping with me with my care, or this service that I'm getting that I wouldn't normally get. I think it would be beneficial to the system if we knew what we were getting for what we're trying to do.
And I don't see people getting services that wouldn't have gotten anyway. As a layperson, but that's
Yeah, I
the
think
purpose of a citizen legislature.
it's been long and slow, and there's been a real issue with the family care, primary care practices. And whether or not, and it's, yeah, those not affiliated with hospitals, if we've lost them between our Medicaid rates and the payments that came through. So,
Yeah, and I wasn't planning on talking about it because you're not the healthcare committee, but we have created some pilot partnerships with primary care practices in Vermont to try and pay them more and pay for services that don't get covered under a normal arrangement, to try and experiment with some different things. I think what we've seen is maybe we can work on some new approaches and then bring them more statewide, hopefully. We're going to give a presentation to the primary care advisory group of the Green Mountain Care Board about that, and they'll get into all the weeds. But I wasn't going to
I am.
Go there, and you're not the healthcare committee.
So,
So the three things I'll just mention super high level, what you're calling now is the SHIELD law on abortion and gender affirming
Yeah.
care. Blue Cross cares very deeply about that law and those protections, because we support access to all healthcare, but also because when the Dobbs decision was first passed, Blue Cross and Blue Shield of Vermont began offering a travel rider for self-funded employers to purchase for their employees. So just to give you a scenario, what we think is that there could be someone who lives here in Vermont who's buying insurance coverage for their family, but maybe one of their family members, perhaps a college student, is living in another state where they don't have access to these services. What this does is allow them to travel to Vermont or to anywhere else that offers that care and have the travel covered. What we are worried about is the other states that are trying to make the support of that care, including paying for it and insurance coverage, a criminal activity. So in the draft I saw of the House bill, I haven't seen if there's going to be a Senate version.
there is a Senate version, and
House protection for payers, and it's the broad protection for the health insurance carrier, but also the employer. It could be for anyone else who's paying for those services. So there's some other things in there we care about, like protecting the data and some other stuff, but I just wanted to let you know that we're strongly in support of that bill. I'm not going to get into the details because they're torture, but we are very concerned about data privacy and security. And there's two areas that our concerns are sort of being heightened right now. One is in the BCures database with the Green Mountain Care Board collecting social security numbers and identified data. So we
maybe that's where.
are going to have some meetings and talk to them about it, but we strongly oppose the social security number being the prime identifier in a database. And Blue Cross has not done that for over 10 years because it's just not industry standard.
Somebody got all my data, including my social security. It happened to several different forms of data. And we all put in unemployment insurance claims. But somewhere, I assume it was somewhere connected with the state, because it seemed to be state officials. There was some kind of a data.
Yeah, and I know this committee has
Just a
worked
pain.
on privacy. Yeah, you've worked on data privacy here. I know you have. And we support, the state using data to improve people's health and health outcomes and all the research that needs to be done, but we really need to be careful about data privacy. And that was, again, one of our largest issues with working with OneCare too, was protecting the data. It's a little bit of a different data issue, but the same thing. And then the last thing, I did ask Chair Cummings to reintroduce the Consumer Protection Bill that was in the legislature last year. I don't know if you were able to do it.
I did, I
Okay.
asked for it, I haven't seen it yet. It was a reissue of last year's bill that I couldn't get taken up in health and welfare. It's pretty simple.
It has a bunch of things like allowing patients to access their healthcare records, helping people get referrals and all of the information that you need for a referral outside of a healthcare system. It had some reporting on wait times. And then one piece that I don't think we've been able to get in yet, and I'll just mention it here, is private equity in investments in healthcare. We are concerned that this could come to Vermont, but I don't think anyone really knows. So what we ask for now is just transparency, and we'd ask it for ourselves as well. We'd
But
like
this
to-
came out of the news story 2 years ago
Yes, yeah.
about the guy with kidney stones that couldn't get a referral outside of the UVM network and was in constant pain for months. And this basically says if you can't get him in to be seen, and I think it's 6 weeks, you have to refer it. You have to send his medical records, all of them. That you can't just sit on this until one of your guys is available.
So thank you for that, and I will stop, but just wanted to mention all those.
Okay, thank you. I'm gonna, unless it's a vital question, I've got to get Mike up.
You said I could go first, so there you go.
Okay.
Well, that's making up for the fact that he was here and you were on Zoom last year.
Okay, thank you.
Oh, she said Nolan's coming to watch us.
Good afternoon, everyone. Mike Fisher, healthcare advocate. So good to be here for a few minutes. I think I'll just also do very, very brief. I think everybody knows my office is, but we have a helpline, and we are available to Vermonters who are experiencing any kind of access to care problem, and we appreciate your support in helping us reach your constituents when you hear about people who are having access to care problems. And we have a policy team that has this ominous task written into state law that we represent the interests of Vermonters before everything healthcare, before the Medicare board, or the legislature, before other parts of state government. We find ourselves all over the place advocating for improved access to care. So I'm a public advocate and a little bit of a watchdog. That's what my team tries to do our best to do. So that sends us into the Medicare board during the insurance rate review process, and Blue Cross and the healthcare advocate are adversaries to the extent that we're adversaries of some of that stuff, because my job and my team's job is to talk about how a proposed rate will impact people's ability to get the care. So the legislature in 2011 passed the standard that health insurance would be, insurance rates would be measured against a couple of standards: affordable, promotes quality care, promotes access to care, protects insurer solvency, is not unjust, unfair, inequitable, or misleading, or contrary to the laws of the state. So that tension between insurer solvency and affordability, consumer affordability, is a place of tension. And I'm sorry that Senator Brock isn't here, because there was a moment in 2011. When he asked then Fishka General Counsel Cliff Peterson, last one passed here.
Wow.
I think the most an important question about this very piece of law: how is the board supposed to deal with this tension? And Peterson said, I wrote it down. He said, a lot of good it would do if the only people for whom it was affordable was Warren Buffett, Bill Gates, and Steve Jobs. Now I was sort of thinking that list of names is a little bit outdated now. We have to add to it, but that because the work that actuaries do, they look at past data to predict future behaviors. And because there always is a range of possibilities and hundreds of factors behind an insurance rate, many factors, that the board would then be in a place of finding the right place on many ranges to improve affordability. I just want to say really clearly, because we've had this fight a number of times, Blue Cross or another carrier might do tremendous work to reduce the cost of their premiums. It doesn't make it affordable. If affordable means, there is this question of affordable for who, because there's a list of people who we know will always be able to afford it, but affordable means for a significant amount of the population, they can manage to purchase it.
And at the same time, if we have pediatric offices, especially private, independent primary care people, and some of our rural hospitals that are financially, some of them are just moving. We had 3 out of Franklin County, just close the office and move.
Yeah.
So that's that's another balance, is the payments that go.
So to that point, UVM asked for last year in the budget process, a commercial rate increase of 19.9%. That is the amount, the increase that they were going to be asking from commercial payers. The Green
This is
Man,
the UVM's new insurance product.
no, sorry, this is UVM.
This is their rate.
This is their rate to private payers. The Green Mountain Care trimmed them significantly. They actually found other sources of that revenue. But at the end of the day, it was 14.77% increase. And, to join with Blue Cross for a second here, without a doubt, there's no theory here. That rate increase translates directly into higher premiums. And more people being priced out of the ability to get the care they need. So despite that agreement with Blue Cross, we have the exact same comment and concern about the increases in rates that have come from, both carriers and the QHP, and we have concerns about it elsewhere in the marketplace too. Blue Cross got an 11.7% increase in their small group and 11.4% in their individual. I don't know what that means anymore. I think at one point when they were combined, I was thinking that a percent was about $4 million. I don't.
I could ask her again.
3.5, 4, something like that. And similarly on the MVP side, 18.3% in the small group and 19.3% in individual. My general message, I think general question to me is, how's it going for consumers? And my general answer is, but for the federal enhanced premium tax credit that bailed us out on the individual market, and that would have destroyed, in my opinion, destroyed access to care if we had not gotten that. We get it for 3 more years, 23, 4, and 5. Other than that, sort of noteworthy positive, rates are going up, costs are going up faster than the Vermonters' incomes. And so more and more people are priced out of the ability.
And the workforce shortages are just.
There's a lot of factors leading to
Yeah.
it, for sure.
Well, they're actually, but high travelers, which are much more expensive. And then there's inflation.
And so I mentioned the enhanced premium tax credits. Those are available to people who buy insurance through the exchange in the individual market, not the small group. So the small group market is out there shouldering these increases without that support. And I think in the past, people have thought of the advocate's office as being more concerned for the individuals than the small group. I want to just say as clearly as I can, we're really concerned about the costs of the small group.
That's your small employers.
That's your small employers. And we think, and so I want to mention one dynamic that we have a real concern about in the small group today. And that is adverse selection, or a sorting of people or of small groups into healthier and less healthier groups between the small group and the individual market, in the self-funded marketplace. I'm afraid I'm going to lose you all, but let me make it real. You're a small employer. You've got 20 employees. And you see a 18% rate increase. And you go, what am I gonna do? I got to shop, right? And so you call up a broker, and the broker says, let me rate you for self-funded. So rate you for self-funded means, is your risk, the risk of your group, smaller than, that predict a lower expense than the smaller. You know, so that's the calculation you're gonna be doing. If you're cheaper, your employees are predicted to be healthier. You get to go to the small group and save some money. Good for you, right? Those that get left behind, those that get the different answer, no, it's more expensive for you. Then they stay in the small group. The small group becomes a safety net only for sicker small groups. That's our statement of concern.
The word safety net just strikes fear.
So, you know, let's say you get a better rate and you're self-funded for a couple of years, and then you have an employee that's got a bad accident or a bad diagnosis, and you have some high claims. Well, you get to go back to the small group. And so the small group becomes, this is our concern.
Yeah. And that's usually what it is, one or two high cost.
Now, there is a product, so we don't regulate self-funded insurance. We do regulate stop-loss insurance. It's a property casualty product, we regulate it. And so the HCA is going to continue to advocate for us having attachment points. I'm getting more technical than I should, but attachment points that would dissuade small employers from dissuade or even forbid. New York doesn't allow small employers into the self-funded world.
Okay.
And I just want to be perfectly clear. This would not be an easy thing for a legislature to pass. You have a lot of employers
Nothing
in here
this
saying,
area is
but we think structurally, this is a problem in the insurance market.
Senator Bursch.
So the small group or self-funded group, it feels like it undermines community rating. But isn't that just, what piece of law, is it state or federal that says, well, you actually always have the option to step out of the group and go and create your own, underwrite yourself?
I think everything that regulates self-funded is federal. It's between the employer and the employee benefit and not regulatable by us, by the legislation.
I'm having deja vu all over again. Did this come before Elcar last year?
There was a stop loss rule that came forward
Okay.
about a year ago. You know, I think I've raised this concern in the past, and I think I've heard Blue Cross say, we're not seeing what you're describing. And my response would be, we're just starting down this path. But it just feels on a very basic common sense level, like it plays out exactly like I described, that you're chasing lower rates and you go get them if you can, and who can blame you for doing that? So I wanted to mention that concern and to mention that
We have, so I'm still within capacity.
Sorry.
that we
No, I'm
think
not.
absolutely is something within state authority to do, and that's it, around stop loss regulation. And I'll also just mention, because I can't resist, I know that the legislature's analysis of where people get together.
Association?
No, not gonna try.
Teams.
Yeah, never mind. Let me let it go because I
Okay,
can't
well,
get
it's
it.
not just me that
Yeah.
does that.
Captain?
Captive, thank you.
Oh,
I know that thank you.
Jumping
I
winner.
know that the evaluation-
You don't want captives?
Captive has such a good reputation in the state because it's been a great revenue source, and there's a lot of reasons why it's been good. Captives in this stop loss space, and it kind of goes a little bit to your question, Senator Gray. A captive in a stop loss space is the sharing of risk between small employers for health insurance. And it is completely outside of healthcare regulation.
Right.
It is, in my opinion, a dodge, a way around everything we try and do to make sure people get, to make sure that we have
Unless
a
everybody's
workable.
in the same camp.
I will mention very quickly, there are a couple bills that we're working on this year that don't cross this committee's path. One of them is about Medicare affordability, that I think,
I told her today.
excellent. And that is called the Medicare Savings Plan. It's a Medicaid program that wraps around Medicare for very low income, older and disabled Vermonters. And so that is a significant project. It's not cheap, but we'll work on it.
Well, then it'll come here.
And then the other one briefly is the legislature passed a few years ago, the immigrant health insurance plan for children and pregnancies. And we are putting on the table this year to include adults. That is,
And that's in Medicaid.
if you're locked out of Medicaid due to your immigration status.
That's right, it went on our bill.
Then this state only funded program will pick up the cost.
Are you looking at some kind of know your rights and privileges with Medicare Advantage?
So you're getting a report.
I think so. I mean, not for us, but like public facing.
Yeah, are we working on it? You're getting a report, I think it's due February 1st now, if they asked for an extension, that asked a work group to look at Medicare Advantage, what's happening in this space of secondary coverage or alternatives to Medicare coverage. And I believe that report is going to say, hey, we need to do better education for people. I don't know that it's going to suggest what you do about that, but we wholeheartedly agree. And we get case after case after case of people who say, I don't even know how we ended up on this. I thought I was talking to Medicare. Suddenly, I find myself in a Part C. And by the way, I tend to try and call it Part C instead of Medicare Advantage because it's not an advantage. But we're talking about the same thing, Part C. I think there's room for significant efforts to, in a way, counter detail almost against the private marketplace that is barraging people with advertisements.
Who that can compete with Joe Namath? Maybe Tom Brady would have that insurance. Okay,
Anyway, that's what I came to talk about.
Thank you. And we will have, I don't know when we're gonna have to deal with this section.
I should add, I am in agreement with the rest of the work group about extending the separation of the market during
The 5 years, which.
the 3 additional years.
3 years addition. Yeah, that should give us some time
Yeah.
to think through these.
And I don't have a good answer to the problem, to the hope that we don't find ourselves at the end of 5 in the same place that we were last year, with no clarity about whether it would get continued and concerns
It
about.
can't be as bad as it was last time. Well, yes, you can do anything with associations. No, you can't do associations at all within a, 3-month period? I mean, it was.
Senator, I think on the continuation of the enhanced premium tax credits, I predict we'll find ourselves in the exact same place with a lack of clarity. Unless we have a Congress that's very
4
clearly
years, huh?
won't go there.
Might influence decisions to run again. Okay,
Thank you.
thank you. And thank you, Commissioner, for putting up with that. So it's-
No problem. Are you all set for me, Madam Chair?
The floor is yours. Most of us have the chairs meeting at 4:30.
next week.
Oh, I'll be done by then.
You should
No
be able
sweat.
to tell us all we want to know about the tax
Absolutely.
efficiency board, yes. And I'm sure we will see more of it this year.
Absolutely. Yeah, thanks for having me, Craig Polio, Tax Commissioner.
Recharge threat, now that we have a limited number of chairs, it's market driven.
You know, invoice me and I'm sure
We
it'll
are
get paid.
charging rent for these chairs.
Awesome, thank you so much. So thanks for having me, Craig Polio, Tax Commissioner. Rebecca Samaroff, my deputy commissioner, was going to be here today, but she's feeling under the weather, so she's not going to join us.
Well, Senator Brock is also under the weather. COVID test is negative, but he has a nasty cold.
Wish them both a quick recovery. So I'm flying solo today. I do have my assistant Mariko driving the slides for us.
Okay.
And so I'm
That's
happy to do that.
That's who we've been getting emails from.
Yes, and I will say this is like my favorite testimony ever by any, right? To just come in and talk about what we do at the tax department, what we're about, brag a little bit.
I filed my sales tax this year without having to call anyone, it has improved so much. Last year I ended up filing twice and getting told I hadn't paid even though you'd taken it out of my bank account. But, yeah.
Improvement, continuous improvement, that's what we're about.
Definitely, it's the first time I can say it was easy.
Awesome, I'm glad to hear that. So great kickoff, thank you, Madam Chair. I mean, I think that we do things really well at the department. We've got things we can work on like every agency, but generally speaking, we have the technology to do the job. We've got people who care about the work that they're doing. And I think that we have very high service levels. I'll start with just a quick intro for me. I think I actually know all of the folks around the table, which is really cool, but I started at Tax in 2011 as a seasonal temporary employee. We hire folks to help answer the phones and process tax returns every year for tax season. That's where I got my start. I did that for a season. I worked in corporate income tax. I worked on our VTax project, both as a business analyst and a project director for a couple of years. And then in 2018, I was fortunate to be appointed deputy commissioner. And then in December of 19, I was appointed commissioner right before the world changed. So, I mean, I consider it a luxury to be able to have seen the department from so many different angles. I know intimately in a lot of the jobs that our folks are doing. I know how challenging it can be. I know how rewarding it can be. And so I've really considered that a real benefit for myself. But I want to talk about the department today. So I might move right to slide 3 that has our mission statement on it. And what is our mission? I think it's a fairly simple one, right? It's to serve Vermonters by administering our tax laws fairly and efficiently to help taxpayers understand and comply with their state tax obligations, right? I really like to focus on those first 3 words, to serve Vermonters, right? How can we make it easier? How can we help people? Taxes can be scary. Taxes are necessary. Taxes can be complicated. How do we make people understand what they have to do and how to be compliant in the system?
And for those who weren't here, the word bark mulch can strike fear that there was a period where large groups of citizens, starting with the tax preparers, arrived in this committee saying, we thought we were doing everything we were supposed to. And then the tax auditor comes out and, oh, by the way, you owe us $300,000 and that's going to put me out of business. And we forced the tax department to hire auditors and they did their job. But we obviously passed laws that were not clear. So if you find me and we don't, if I have any say about it, the last one was veterinary medicines. Base them on who uses them. The bark mulch was if you put it on your roses, it was taxable. If you put it on your tomato plants and you were a farmer, it wasn't, which left the vendor obligated to figure out what you were going to do. It came through here last year with the cannabis. And were you going to use the clippers you bought that were tax exempt if you cut your tomatoes, but not if you cut your cannabis? And we didn't do that.
The infamous use-based exemptions.
Oh.
Yeah, they can be real tricky.
The other one, the last one was veterinary medicine, if it was gonna be used on a farm animal. And I said, what about your sheepdog that herds your you know, your sheep during the day sleeps on your bed or in front of your fire at night. Is that a domestic animal or a farm animal? Cows, well, there keep popping up stories about people who let calves in the house, but generally cows are farm.
I feel like a secondary mission is to serve anyone who comes to the state who needs to understand our tax law,
Sure.
not just Vermonters. And I've made the chair aware of this, but as I understand it, there might be ongoing litigation with Burlington around people at short-term rentals who were charged if they stayed longer than a month, but they were charged the rooms and meals tax. Do you all weigh in or try to make sure that people see justice in a situation?
So that's actually, that is a Burlington specific tax unrelated to the state rooms tax. So unfortunately, it's not something that.
It was like just the local option tax?
Not even that. Burlington has their own room and occupancy tax. So it's not something that I have any jurisdiction over.
Okay, and you don't?
They have a charter that
Yeah,
allows them to regulate places of victual. That's how old it is. Yes, and they have had a rooms and meals long before any other town got permission to do it.
Yeah, so I have heard about this issue, but again, it's not something that we have any control over. So unfortunately, I don't have a solution I can bring to you.
okay. I just, in my mind, it's Vermonters and visitors, you know, we just want to make sure they have a good experience of our state.
Yeah, and I think I'm happy to expound upon that a little bit. If we move to the next slide, it talks about our core values, and I might just briefly start because establishing core values is actually a fairly recent activity for us. We did it in 2021. And as far as I'm aware, the department's always had a mission statement, but we had never established core values. And after, again, I don't remember the exact point in 2021, but we would have been coming up on 2 years of emergency management from COVID at that point, right? And we were facing a still very uncertain future. So we thought it would be worthwhile to establish some core values to be able to have a shared language. I kind of look at it as like a North Star about who we want to be as a tax department moving into that uncertain future. And it's really given us a lot of success in the way that we can talk about decisions we make or analytics we run or how we serve Vermonters. And we established 4, so our first is service, right? And that's really the one that I think came most organically to us because of what we had been doing pre-pandemic and then certainly during the pandemic, where I will say, like, my staff basically said, how can I help people? Point me in that direction, right? We were doing things we didn't normally do. We were handing out grants to businesses, to municipalities. We were taking in federal money, giving away federal money, all, I think, very quickly, very effectively. And people basically just said, we're in a tough spot. Like, how can we help? On the realm of tax administration and service, there's some academic studies that back up what I think will be intuitive for this committee. The first is that, right, the bedrock of the US tax system is voluntary reporting, for better or worse. You tell the government what you owe, you make your payments, we make adjustments perhaps, we reconcile, we send you a bill, we send you a refund, whatever. If people do not understand what they owe, they are less likely to file at all and less likely to file accurately. Right, and that's backed up with academic studies. But those same studies have shown if you take the service-oriented approach of helping people, of putting information out there, of being accessible, it has a meaningful impact on that compliance rate, right? Aside from that, it's going to be a more enjoyable experience for our taxpayers and our department if we're operating with that service-oriented focus, right? Second goal is integrity. Again, bedrock in the tax system is voluntary reporting. We need people to be doing the right thing. We're asking our taxpayers to do the right thing. We have to do the right thing too, right? That sends the proper message to those who want to do the right thing, but it also sends the proper message to those who are not going to do the right thing, if we are, right? And I see a few pillars of that. One is we've got to exercise our confidentiality provisions with maximum effort, right? It also means that at all levels of the department, we have to make sure that we are trying to collect the correct amount of tax, not act as a revenue maximizing agency, right? And we have to hold ourselves accountable. We have to have a culture that people can admit mistakes and believe that we will help support them, correct those mistakes, or also if they see something wrong happening, that they can report it and know that we're going to take action on that. Our third value is growth. And I don't necessarily mean growth of revenue there, right? I mean growth of like how we provide value to Vermonters, right? The pandemic has changed the world in so many ways, and there's a lot of stuff that I know this committee's intimately familiar with that hits our world of tax administration, right? Cryptocurrency, gig economy, remote work, right? Like all of those kind of things are still like an uncertain future in the realm of taxes and tax administration. So we have to evolve to be able to meet that challenge of the modern world and meet our taxpayers where they are. It also means that we have to have the most engaged workforce possible, right? To be able to help navigate those challenging questions. Among the things that I'm really passionate about as commissioner are organizational health, employee engagement, and employee morale. We have an extremely talented workforce that I have a great pride in what they accomplish and how much they care. And I need to make sure that those folks see themselves as part of the future of the agency, find their jobs fulfilling and rewarding, and that they have that service-oriented approach. And the last of our four values that's established is community. And that's really the value that all of the other values sort of feed into, right? We are uniquely positioned in state government, aside from maybe the DMV, with the breadth of our constituency, right? We are interacting with virtually every Vermonter, sometimes non-residents as well, as Senator Robbinsdale mentioned, right? And they come from all different walks of life, right? Different backgrounds, different culture, different languages. We have to be ready to serve them all. And we're going to feel better and do our jobs better when we're supporting each other internally as well, right? When we are comfortable asking for and receiving help and recognizing that place in society that we hold, right? Businesses that we frequent are collecting sales tax on behalf of the state, right? When somebody calls really looking for a refund or a rental credit or a property tax credit, right? Those are our friends, family, neighbors, right? We have to recognize that as
You've
we're
been very
doing our job.
patient with me.
Say that again.
You've been very patient with me trying to learn how to file my sales tax.
We're there to help, Madam Chair. That's the whole point.
Very helpful.
Yeah, we want to be accessible, right?
I felt great success this year.
I appreciate that. And we took those values and we fed them into what I call our three overarching goals on the next slide. The first is that I want us to be recognized for our service-oriented approach. I want us to be recognized as a model for service-oriented tax administration, right? Every state agency and every revenue agency around the country say they want to be service-oriented, right? But there is a very different level of service out there, right? I did an experiment once where I just called the regular taxpayer services line for a whole bunch of tax departments. About 25% of them hung up on me. This is the regular line to get help. They just said, we've got too many calls and we can't take your call, please try back later, right? The IRS struggles with this from time to time. I saw a website once for a revenue agency that had a frequently asked questions on their filing page. And every link in their frequently asked questions went back to the home page with no further instructions. It just said, you can file on our website, and you click that and it went to the home page, right? That is not what we're about here at Vermont, right? We want to make it as easy as possible. We want to have that service-oriented approach. And I want to have stakeholders like you folks and your constituents reaching out about what a great job we've done, right? As opposed to reaching out about how they couldn't get help when they needed it.
Before I was a senator in 2018, I remember doing my taxes. The one time I ever had to call the Vermont Department of Taxes was I filed and I forgot to do my DHEIP credit.
Sure.
So I picked up the phone, I called, and I got to say it was the easiest experience I ever had. I got the money and they made it, it was like a 5-minute conversation and they corrected my tax return. So bravo for my personal experience.
I also have, I have a story of how wonderful the tax.
I'll take these all day.
Okay, well, this is very simple,
I
besides,
believe we're having a love fest over taxes.
well, that's what I was gonna get to. I mean, from both my wife and I have incomes, we have salaries, income, but we also, because of my side gig with the guitar, we file quarterly estimates.
Sure.
And she does all our finances, and she just misplaced the little coupon book, and so we had to do one late. And she was very worried about it. I was in town anyway, so she said, "Could you possibly just, you know?" And I can't tell you how helpful and friendly people, because I'm coming in having messed up, and it was just they got it done, helped me get it done. So good, awesome. What I was going to say is, I don't think the people are ever gonna love you because the service you provide is you take their money. They're gonna hate you no matter what you do.
I don't think that has to be true, but I do recognize, and that's part of the challenge, it's part of why this is so important to me, right? It can be a thankless job, right? And I want to make sure that those people who are doing that feel rewarded, feel supported. But I hear you. I don't think it has to be that way, but I hear you. That is a challenge.
It's our job to give them the service they need
That's right.
with the money you collect. Pretty much on our behalf, we set up what that money gets spent on.
Absolutely.
So, okay, Senator Braun.
I mean, I've had a fine experience with the tax department, but my question is, how are you measuring progress here? I mean, we talked about a phone experience, it sounds like maybe in person. I mean, digital services would tell you that Vermonters increased their interaction with state government 5-fold online in the pandemic. And, it wasn't you all, but we've had tax forms go to the wrong people in recent years. So you have an
This was
obligation.
not related to my
It's
department.
not related to your department, but it's still, an obligation to make sure people's data is protected, to be, are you setting goals so that as people access their forms through state government digitally, they can do that conveniently and it's safe? I feel like, that's still a part of your responsibility, because when that happens through Department of Labor, people who had stolen information were able to file before the individual, right? So we have identity theft issues and things, and I'm wondering how you're constantly improving in this area.
So I wonder, I have a slide on our IT systems near the end.
Okay.
So I wonder if maybe that will help
Sure.
answer it. But I do want to maybe expectation set a little bit, right? Every business is required to send W-2s federally, right? For that tracks federal wages and state withholdings. Agencies are required to send 1099s. I don't think we can say that it's the tax department's responsibility to ensure that all of those entities that are doing that are doing it securely. Like there's no way that we can provide that oversight. Where I think our responsibility lies is when an issue occurs. Gotcha, okay, then I think we're on the same page, right? Like our
Right.
responsibility is then to recognize that occurred.
Yeah.
We're not in a position to stop it when another entity has an issue. like that.
Right.
But we're in a position to recognize that that's happened. And we see that frequently, right? The latest trend as well is, unfortunately, particularly insidious, hacking tax preparers,
Yeah.
right? Who have client lists, right? And so we've got a lot of different elements, a lot of data sets, a lot of data sharing between the IRS, between other states. We've got our own metrics that, have algorithms and all of those different kind of elements to go in to try to make sure that we are not really succumbing to identity theft fraud.
Mhm.
What I am proud to say, we have seen, unless we're missing something big, and I don't think we are, because we do after season debriefs, right, where we go back and say, is there anything that we now know we sent out that we shouldn't have? And we don't see big issues on that. We have seen a downward trend in this area for several years. I think there's a few reasons for that. One, we have more data than we have ever had before. It is actually quite hard to get something by a state revenue agency or the IRS if it ends up showing up on a reporting document, like a W-2, a 1099 or something like that. And in terms of the amount of information that you would need to successfully file a current year identity theft return and get it past us is fairly high, right? So that's the good news. I also think Vermont has taken particular focus in this area for several years, which I am hopeful acts as a deterrent for those who are in the business of committing these kind of crimes to say, all right, Vermont's a hard state to get it through. We're not going there. We're going to go to this other state where it's easier to get it through. Not that I'm encouraging those crimes, but I mean, our responsibility is to protect the Vermont system, right? And so we try to make sure that we are among the best in the nation at those kind of things. Am I getting at the heart of your question there?
Yeah, and I just hope you do use your experience check-ins, just to
Totally.
make sure that we're doing the best, giving the best possible service digitally so that we're not reliant solely on TurboTax.
Yeah, I think our VTax system is among the most powerful IT systems of Vermont state government. It transformed the way that we do business. We get over 90% of filings. We don't have personal income tax through there because of the commercial software vendors, but sales tax, meals tax, insurance taxes, miscellaneous taxes, right? We get probably 20, 25 taxes almost exclusively are filed through there. And we try to keep really open conversations with the preparer community and business community about like, what are the challenges that you're seeing, right? And we can hit challenges, right? We're a small state. So it can be difficult, for instance, if we have an issue with a tax software preparation company, they might not give us first priority of taking that call, right? So there are some challenges there, but I do think we're responsive. I think we're sensitive to that. And I think for the vast majority of cases, we're hitting the mark. But I appreciate the general mindset. I mean, that's where our head is at too, right? We've got to make sure that we're hitting the mark on that
I
stuff.
think the big issue is when you make a mistake, and people do, that when you call up, you get help and you're not treated like a criminal.
Yeah.
You're treated like, yeah, you've been filing taxes for 50 years and you made a mistake and we'll fix it.
Most of the time, our wait times for our phone are under 5 minutes. If you call on April 15th,
Yeah.
it's 15, 20 maybe, but like we are there to help and we want to be helpful. Like the vast majority of people who owe us money are not trying to cheat on their taxes, right? Most people, vast majority are making mistakes, right? And so how can we help? That's got to be our mindset. And I think it is. Sorry, Matt.
No, guys, just saying, okay.
Well, it's a great feed into goal number 2, right, which is reduce the tax gap. And this is really a foundational goal of virtually any revenue agency, right? And I will admit, so the tax gap is the difference between what should have been filed and paid and what was. It's a really complex number to know. And to my knowledge, we've never done it at the state level. It would be a tremendous undertaking, but the IRS estimates it every few years, and it's usually outdated, but fairly consistently over the last several years, the IRS has estimated that even after their compliance efforts, the federal tax gap is between 14 and 16 cents for every dollar. Meaning if the federal government should have gotten $1, it got between 84 and 86 cents, right? So we know we have one. We don't know exactly how big it is, right? But we have to make sure that we're doing everything we can to reduce that. And I think it's two main strategies, right? Strategy number 1 is that voluntary compliance strategy, right? Understanding the vast majority of people who are not filing or paying correctly are doing it that way because they don't know any better. They don't know what the rules are. They don't know how to do it. Let's help get them at the table. But the other is empowering our compliance division to find those who are not going to get on the right side without some help, right? And finding even there a service-oriented approach that will ensure that moving forward they continue to file correctly, right? So it's a two-pronged approach.
There's the ICE issue, which was Senator Moz's. Is ICE taxable or not if you buy a cat?
Yes.
That was the first thing Senator Moz had told me to ask. ICE. Because, he sells it, but he said half the people, the stores don't sell it. And then there's, if I buy a bag of potato chips and I take it out, or if I eat it standing in the deli, again, it gets confusing.
Sales tax exemptions are among the most complicated part of state tax.
Yes, and guess who writes those?
I don't know.
The bagel tax.
I'm sure
Yes,
we had a half a dozen years in a row where there were errors, where people weren't paying taxes for mulch, they weren't paying taxes for farm machinery, and they weren't paying the taxes that the law called for on auctions.
auctions was one.
And in each of those cases, previous administrations went out and sent everybody a tax bill for the last couple previous years, plus the penalty for not having done it. And they did this 1 year, and then again the next year for a different one, and then again the next year. And we're sitting here with all our colleagues getting phone calls about how people were getting whacked with these taxes and penalties for years gone by that people didn't know they owed. And everybody that got the phone call vowed to get to the bottom of it. And we don't tax the auctions that we used to, the mulch went, the the sales tax on farm machinery just went out the window, and I think there was another one because of our colleagues' outrage at what was going on.
It was,
But this was a previous, these
Yeah.
are previous tax
but
department previously.
we also wrote the laws they were set to enforce. And to me, it is a huge demonstration of failure on all our part.
Yeah.
When the average citizen can't read what's taxable and what isn't and understand it. And one of my goals is when we write something, the average citizen should be able to say, yes, that's taxable, or yes, that's not. And it's.
I'm sure when it isn't obvious, we shouldn't hear about it from all our colleagues
No,
who've gotten phone calls because the bills plus the penalties went out, because that's just a formula for losing that tax forever.
right, and I think that this is where the customer service orientation comes in. You know,
This,
you
so
call
far,
it-
this administration hasn't done that.
No,
And
they haven't.
they've taken a different approach.
Yes,
We intend to continue that.
yes.
I hope that's,
Last year, property valuation review was in here, and we were asking questions, and I said, you know, I'm supposed to get a letter that I send back in that says I haven't sold any of my current use property, and I haven't gotten one. And she said, well, there's something going on there, a lot of letters, and so we're only doing half of them 1 year and half of them another year. And that struck me as being kind of weird. And then I got a letter in March that said, we didn't get your letter back in September. Here is the letter you should have done. Get it in by sometime in April, and everything's good. So I went, wow, that's kind of a different approach, but thank goodness. You know, I got the letter, was able to send in a letter saying I hadn't sold it. And
that's a great example of what I'm talking about, right? So those are the agricultural certifications, right, our current use program. And our experience was that, again, the vast majority of people who were not sending them in, who were then getting triggered the land use change tax withdrawal from the current use program, were farmers who were farming, right? And not necessarily keeping up on the paperwork, right? And so again, take a different approach of like, well, we're going to guess you're still farming because we haven't heard otherwise, right? But we've got to make sure that we're being sensitive to the fact that some people really do need to exit the programs. It's a great example of what you're talking about. I hope that the committee has found that that has been our approach since I've been in this position of coming to you guys when we're having challenges and trying to talk them through. We'll debate, right? We always do, but I felt like it's been a good partnership.
coming in afterwards.
Yeah, I agree.
Because we call you in because we heard it from our colleagues.
Exactly. And I'm proud to say that aside that we had a little blip at the start of 2020 where we redeployed basically our entire compliance division to some of the emergency management stuff, right? But aside from that blip, year over year for the last many years, probably 5, 6, 7 years, our compliance revenue brought in by our compliance division has gone up year over year, every year, right? At the same time that I'm hopeful you folks will agree when I say this, that our number of complaints, particularly to stakeholders like you, has gone down and down and down, right? So we are bringing in more money with fewer complaints, right? And like, that's just win-win-win for everybody. And our third overarching goal, I want the tax department to be the best place to work in Vermont state government, right? And that's a subjective goal, I get it. I have 150 staff members. If I ask 150 people what that meant, I'm making 150 answers. That's okay. We've got to strive for it, right? I care deeply about organizational health and the experience that.
Not you, the tax department
Yeah.
went through a rough stretch and there were a lot of people that left, so.
Yes. So we're working on it, and we're not perfect, right? No agency is, but we have to be focused on it and care about it, and it matters. I don't know how I'm doing on time, Madam Chair. I don't think you guys-
You got about, not quite 15.
Okay, so let's hit the key statistics slide. Next slide, please, Maud.
We'll be quiet.
Oh, no, all good. I'm happy to take the feedback and questions and talk this stuff through. So key statistics, so we've got 150 employees, as I mentioned, across 7 divisions. Taxpayer services, which is kind of the front door, front window to the tax department. If you're calling, asking for help, you're probably calling taxpayer services. Our compliance division, that's comprised of collectors, so people who have not paid voluntarily, trying to get them back in compliance, as well as field auditors and office auditors. We have property valuation and review, which does a lot of municipal service support through our district advisors that are housed throughout the state. We've got a finance and revenue processing division. So that houses our internal business office, but also anybody who's mailing us a paper return or mailing a paper check. We make sure that we digitize it and get all the money in the proper bank account. We've got a legal team. We've got our VTax team, which is our IT team, and I'm going to talk about VTax a little later in my presentation. And we've got the Office of the Commissioner, which houses a lot of our comms team, our analysts, and things like that. We have an exceptionally talented workforce. I can't say it enough. Like, we have been, from my chair, doing very, very well, especially over the last several years, coming out of the emergency management of the pandemic, what we did in the pandemic. I've been extremely proud of that, and I give all the credit to the staff members who are doing the day-to-day, getting the results that we're talking about, getting the results of higher revenue and lower complaints. We've got 32 tax types. Please don't ask me to recite them all from memory. I cannot do it. But I can tell you the 3 benefit programs that we have: the renter credit, property tax credit, and current use program. And obviously everybody knows the big tax types, right? Personal income tax, sales tax, sales tax. But we've got insurance premium tax, captive insurance tax. We've got hazardous waste tax. We've got wind, electric generation facility tax. We've got 32 different tax types, right? And all of them have a constituency that we need to make sure that we're standing ready to help them out however we can. And we've got a number of teams throughout the department that do that. One of the stats that I find kind of eye-opening, because I'm not sure if many people recognize what an operational department we are, but in calendar year 22, we processed over 1.2 million tax returns, right? And so people may, again, be familiar with the fact that we get about 400,000 personal income tax returns. We had 275,000 sales tax returns. We got 175,000 withholding returns, and we get returns for all of those other 30 tax types that we're talking about as well, right? So it's a very operational machine that peaks right around now, right? Tax season opened yesterday for both the IRS and the department, and we're going to be working our tails off through the April 18th deadline, and then after that to process tax returns. And then in the late summer and fall, after we've processed the vast majority of current year stuff, we build out the next year, right? And all the while we're serving the other tax types that have maybe different timelines as well. And that resulted in over $2.6 billion collected for fiscal year 22. Most of what we collect goes to the general fund. We also collect sales tax, which is 100% ed fund, over half a billion for that. And so most of what we collect goes into the general fund, and we also collect most of what goes into the capital fund. But we also do have some significant ed fund collections. Last year, we had an operating budget of about 24 million. So if you do the back of the envelope math, that means to collect $1, it takes about a cent. I'm, again, really proud of that. I think that's a fairly low overhead, and that we've proven ourselves a very efficient department. And the last bullet is a stat that I'm really proud of, right? So we had a couple of years where there was a lot of crazy stuff going on in the world of taxes. Due dates are changing because of COVID, retroactive unemployment insurance.
Changed it after people filed.
Exactly. So what I was really thankful for this past filing season was that it was kind of normal. Right? We didn't have due date changes. We were able to just keep our eyes on the prize and see how efficient we could be. I set the most ambitious refunding goal I'd ever set for the department, which was I wanted to hit 95% issued by June 1st, which is 45 days after the due date. We did that. We also upped, I don't have our old stat on this, but I have the new one. We had traditionally issued between 70 and 75% of our refunds within 30 days of return receipt. That's throughout the entire year. And we upped that to 82% last year, right? So we are looking to maintain this, right? And this is part of that. How are we making sure, like, keep improvement on this kind of stuff, right? It's the people's money, get it back to them, right? But also make sure that we're protecting the integrity of the tax system, finding erroneous refunds and stopping it, finding fraud and stopping it, right? If we move to the next slide, please, Maud. This is one of my favorite slides. This is like the embodiment of the voluntary reporting system, right? So these numbers are not exact, but they're pretty darn close. I rounded. But out of the 2.6 billion we collected in fiscal year 22, the blue part of the pie is what came in voluntarily. It was reported to us. It was paid to us. We stood up systems. We built forms. We had instructions. We did not have to bill for it. We did not have to offset it. We did not have to audit it. We did not have to send a collector after it. 98%. and 2% came through our compliance division. But I really want to stress, that is not because our compliance division is not doing their job. They brought in $55 million, right? But you can also see the challenge that lies ahead of us a little bit on the tax gap. I said that the federal tax gap is about 14 cents on the dollar. If you just scale that to the Vermont General Fund, it's a couple $100 million, right? Now, I don't know that it's exactly that, because again, it's a really complicated thing to do. But if it is, right, you can see the problem that lies ahead of us in terms of finding our way to audit out of that, right? We have to bring people into the blue part of the pie, and then also find people who are not going to come into the pie at all and get them at least into the red part. Right, but this is again really the embodiment of that system at work, that the vast majority of the money comes in just because we stand up the systems and help people figure it out. And my last slide, I think it's my last slide, is the next one. This is just our VTax homepage, and so I just want to talk a little about
I have an
VTax. Right?
icon that says my tax home on
Yeah.
my.
So we have VTax, and it is awesome. And I could talk about all day how awesome it is, but it was fully implemented several years ago. We continue to make ongoing investments in it, so we patch it twice a year, and that brings in new features, brings in security updates. We also do full version upgrades every few years. The last was in 2020, and again, that brings with it a suite of improvements. We have an internal team that is comprised of business users from around the department, so folks who have expertise in that area, working with state developers through embedded Agency of Digital Services developers, and also developers from the company that builds the software, Fast Enterprises. Their developers are here, they live here, they're part of the community. And so all of those folks are working year-round to build out normal enhancements, build out legislative changes, build out whatever we decide that we want them to. So we're constantly making investments in the system and trying to make it better. And it handles everything for almost everything the department does, soup to nuts, registrations, payments, returns processing, transactions, collections, billing, auditing, and it has a portal for file, right? So it's one integrated system where before this we had 3 or 4 disparate systems that didn't always talk to each other, couldn't always work effectively together. But I believe over the course of implementing this system and since then that we've proven at the tax department that we can do IT well, and we make sure that the investment counts.
I'm assuming that your staffing has gone down. There used to be people whose job was to input.
Yeah.
And they just sat there and put paper forms in, and seems fewer employees.
Yeah, so I'm thankful to say it's been level for many years. Last year, we got 2 staff to help administer the child tax credit, and we were thankful for that. But we lost like between 30 and 50 in the 2008 crash, and we never got them back, right? So we've sort of had to be leaner and find smarter ways to do our work, and we have done that. This has been one of the key reasons, right? Combining this very powerful technology with very talented workforce, I think is the reason we've been able to hit the service levels that we have. And sort of the last thing that I want to say while I'm here, and I just want to be able to say publicly, is I have been very appreciative of the partnership that we've had with the legislature as a whole, but this committee, when we are talking about policies that you folks have trusted us when I've come and said, that's really hard for us to do. Right? And I hope that we've established credibility also with you guys knowing that we have this technology, that if I'm saying it's tough to do, it really is. And you guys have demonstrated that you're willing to tweak things as that's happening. And again, we always can debate on the policy side, but I've really appreciated an opportunity to have very transparent conversations on the operations side. And that is another reason I think we've been so successful. I have spoken with my colleagues around the country, and they do not enjoy that same luxury of their executive and legislative branches working together in that same way. And I've talked to tax commissioners who said, I went in, I told them I couldn't do it, and they're making me do it anyway, and I don't know how to do it. Right? And I am very happy to say that rarely, if ever, have I been put in that place. And I'm hopeful we're able to continue that relationship this session as well. That's all I got, Madam Chair. I appreciate
Okay,
it.
some of us have to leave, so we got quick questions.
Real quick question. So there's There's also filing to the Secretary of State, like annual report and fee for corporations and stuff. Are you linked into that, or is that now subsumed by this site, or?
We are not linked into that. It is, I know the Secretary of State is undergoing a project to try to see how much of that can get integrated. I am not aware of any states having that full integration. And it can get really challenging to do that. And I'm sure you can imagine that if something goes wrong in a system that integrated, it can go really wrong. So I'm not aware of any states having done that, and I'm not sure that that will be the final end goal of that project. And certainly I would want to defer to them about the specifics of that project, but I know they are undertaking that. We have traditionally taken registrations through their website. So you go to register for the Secretary of State, you can pass that on to the department so that you don't have to come register with us separately. That's been a success. And we look forward to that continuing with their new project. Sure.
I don't use your website because,
Oh,
no, my wife does our finances. But I would just say, it seems to me the criteria for any website is that presume the person using it does not know how to use it. But presume the person using it is reasonably intelligent and attentive. That person knows exactly how to use your website based on the information they've been given on that website. But that's very rare. What I just described is very rare.
You keep it around.
We did usability testing. We brought people in, like business owners and professionals, and it was one of the coolest experiences of my career. Because we would have something that I'm like, oh, that's so easy to use. And then I'd see somebody sitting there looking around for 3 minutes. I'm like, oh God, we missed the market, right? And then we were able to tweak it, right? And then the next thing we know, we do another round and it's right there. And that
Well, people who design website will say, for example, they use the
Yes,
word.
the committee has to
Sorry.
go across the hall.
I'm nerding out, Madam Chair.
So,
Between you and me, they use the word intuitive,
Yeah,
like that's a good thing. Intuition, when I have my intuition, you have yours.
Yeah, sure.
They may coincidentally be the same thing. We may, but just entirely private.
chairs.
Yeah.
Logic.
So.
Logic has a structure and
Yeah,
value.
that's the majority.
I
Okay,
want a logical site, not an intuitive.
okay, the
site.
door is
We're doing what we can.
open, the